Welcome back to Mostly True Psychiatry with me, Dr. Mellon. This is going to be our anxiety module. I'm going to basically just focus on two things. It's going to be generalized anxiety disorder and it's going to be panic disorder. If you can treat those, you can treat anxiety when it comes to actually being a psychiatrist. For a therapist or something, obviously, there's 50 other layers to this. I'm basically going to do the same process. It's going to be just working on the diagnosis. What does that diagnosis really mean? And then working on what are the real treatments? How do you do it? So for generalized anxiety disorder, DSM stuff, basic criteria, it's got to be going on for a long time, 6 months, so 6 years something, right? For half a year. And they're worrying about multiple events. Common examples always listed are aimless future. This would tie in with depression real easy. You're worrying about you haven't achieved anything. I'm not going to reach my goals and my ambitions in life. My future job prospects are horrible. My life has no purpose. I guess existential crisis real fast, huh? Finances, worry about those. So make sure they're not just poor. They're just, they're having a hard time. Don't call it a excessive worry when they're actually dead broke. But like they're afraid, they're unreasonably so, whatever that means. About not being able to afford things, inadequate living situation, money is not going to make it to the end of the month. They don't have enough money to do the things they want to do, like even basic things. Lack of confidence, obviously pretty normal for some portion when you're younger, but it's feeling insecure. You're unable to be assertive or express your opinion. You're always afraid about looking stupid. Am I looking stupid right now? No, it's all good. That others do not approve of me. So just lack of confidence, which doctors, I guess, tend to have too much of it. Relationships. Again, it's always out of proportion for all these things. Like they're worried about they're not attractive enough, they're not loved, they're going to lose the people that are around them because they're not going to make them happy enough or do something wrong, like the disapproval fears. They're afraid of losing close friends, they're afraid of just angering the other person, so they're kind of walking on eggshells and apologizing to too many things too often, which could just be insecurity. So these are common things people worry about that count as generalized anxiety disorder. We'll go over that in a second. Work, school stuff. Afraid you're not working hard enough. You're going to be late. The things that you got to turn in is going to be late. You're going to make poor mistakes, bad grades. That it's got to be finished. You can't let anything work on a normal timeline and process. You're afraid you're not going to keep up with your own workload. You're just getting overwhelmed. So these are common examples of things you'd worry about. So that's aimless future, finances, no confidence, concern about relationships, your ability to perform and do your duties for work and school for 6 months, and you find it hard to stop control your worrying. So as long as they say they're worrying for a long time, you're there. It's got to cause impairment, so it can't just be. It's annoying. They think about this thing a little bit too much. They jeopardize the relationships. They're not getting the work done, that kind of thing. I've skipped one intentionally. We'll get there in a second. It's not due to another medical condition. So reasons that you can become anxious due to a medical condition. B12 deficiency. This is a zebra. Don't worry about it. I mean, we check it. We do all this stuff. You can get a little bit of B12 deficiency is geriatric, and it's the vegan, right? But I don't know. I've yet to see that patient in a meaningful manner yet. Cardiovascular and pulmonary issues, right? So if you're not getting oxygen to your brain, you're having chest pain, think you're going to die because of that condition, then that's going to cause anxiety. That doesn't make it generalized anxiety disorder. Hyperthyroidism, while it's elevated, will make you anxious. Hypoglycemia, so that'd be super short, super obvious, right? Thyroid, you check and you know the answer to that one as well. A lot of autoimmune disorders can have it. So anytime somebody walks in with some weird werewolf disease like SLE, lupus, anxiety can be part of it. And pheochromocytoma, another werewolf disease. And it's not due to another mental condition. So This is the way I kind of wrote this down today to give you an idea. I'm going to make this chart available. You can have it. It's fine. So the source of anxiety matters to the DSM. What you worry about decides, is it GAD, generalized anxiety, or something else? We treat it the same. We do all the same stuff, but they just broke it apart into all these things. So if you don't know about what's going on with your future, your finances, confidence, relationships, school, work, whatever, generalized anxiety disorder. But if you're worried about your weight, not just your physical appearance, but like weight, now it's going to be bulimia or anorexia. So I guess it gets a new category, which, okay, I know this has other issues with it, but just go with me for a moment. Physical appearance. So if it's a slight flaw and you're hyper focused on it and you're like, oh, my tricep isn't as big as it should be, and they're like working out all the time, or they're constantly putting pancake makeup on and trying to look like, oh, there's like one blemish that's tiny and nobody gives a crap about, but that's all you care about and you're always worried and keep checking your mirror and doing everything, then that would put you in for like a body dysmorphic disorder. So that'd be minor though. They can't be hunchback with one arm, and that's embarrassing to them. That's normal. So there's physical symptoms set up about anxiety, and it gets its own special breakdown. So if they have a minor, quote, or none, physical symptom, and they're really focused on it, like my heart rate's going up, but something wrong with my heart, then we say illness, anxiety disorder. If they have a physical complaint, like a physical symptom, and it's like obvious and severe there, like maybe they do have chest pain, and now they're like hyper focused around it because they've had a heart attack 2 or 3 years ago, and now their whole life revolves around it. That's a somatic symptom disorder. Let's just go ahead and make a correction. Boom, while we're here. Capital. OCD, not OCPD. Another lecture, another time. So the obsessive thoughts and discomfort and the compulsions, that gets its own separate thing. We still treat it the same. The first 2 lines of treatments are the same. It didn't matter if it was that. Any of these are GAD. If the treatments start off the same. Panic attacks. We're going to talk about this as the next piece to this, but so there's a panic disorder, and then there's a panic attack specifier. If it's just the panic attacks, that's not considered GAD. PTSD, it's kind of weird. It's like hypervigilant. It doesn't really have like generalized anxiety for it. If you do the interview at all, I mean, it shouldn't look like GAD. It would be kind of hard to confuse, but maybe the patient's just weird and giving you a weird response to questions, that it could get tricky. But they're hypervigilant. Triggers that are causing them anxiety are specific things. They're avoiding situations, and they've had a traumatic event, right? But then they're getting like guilt and shame the rest of the time, difficulty concentrating, whatever. Delusions, if they're psychotic, you should really chase that down before you get all caught up and go, oh, it's schizoaffective disorder, GAD, or whatever else. Just work on the psychosis first. Fear of separation. So you get broken apart from your attachment figure like a 2-year-old and freak out, or a 5-year-old, then that's going to be a separation anxiety disorder. It can be adults. And then negative evaluation. You're always like, are they going to think I'm moving this hand too much? Am I not putting my head quite like it should be, or whatever? That's social anxiety disorder. So all of those, if you have those kind of worries, not generalized anxiety disorder. Treatment, what do you do about it? It's the same. SSRI, SNRI, doesn't matter. It's first and second line. We'll talk about treatments in future videos, but it's like it doesn't really matter which of those things it was. So one thing that gets a little confusing are the autonomic nervous systems for generalized anxiety disorder, because it's kind of a differential for panic a little bit, panic disorder, and it's not as super obvious as you think about which is which. All right, autonomic nervous system, the idea that you've got things like body temperature, you've got your blood vessels, how much they're constricted, the rate of your heart beating, how fast you're breathing. This is all autonomic nervous system, right? You learned all this in medical school. So when it comes to generalized anxiety disorder, I did this wrong, I gotta fix this. The symptoms are generally either just like they feel achy, sore, twitching, trembling, shaky, kind of they might be a little sweaty, nausea, feel like they go to the bathroom. That would be considered generalized anxiety disorder. When it goes to panic disorder. So I think it's DDX, panic disorder, GAD. There we go. So when it's panic disorder, it's just more severe. So it's supposed to be like paresthesia, we said shakiness, no, it's trembling, right? Big difference, not really. Fear of dying, going crazy, losing control, like that you're just afraid of, like you're just panic, right? Shortness of breath, lightheaded, dizzy, unsteady, that kind of feeling, any kind of palpitations, chest pain. They get not abdominal, some people do the butterflies in the stomach, nausea, abdominal discomfort, sweating, chills, flush. And then depersonalization, derealization. So this is like a PTSD and panic disorder kind of thing. So it's just more mild, way toned down. It's not as common for generalized anxiety disorder. So for panic disorder, the things that make it different, okay, it's only 1 month, it's not 6 months, it doesn't have to last very long. It's not due to those same other medical issues that we already talked about. It's heart, lungs, your adrenals are dumping adrenal, thyroid's jumping thyroid. It's not due to another psychiatric condition. It's the same vomit list, right? It's this thing that you can grab. All the other reasons people, they're just boxes. All the ways that a person can, not even all, just a lot of ways that people will express worry, right? You could probably find a few other categories you could put, but it doesn't really matter for psychiatry. So for them, they're really going off that list we just went by. They got to have at least 4 of those symptoms, which we fake it, really. I mean, psychiatry, right? Half the time you're just saying they feel like they're overwhelmed and they're getting autonomic nervous system signs. We might want to do a little bit of medication difference. That's really it. That's the only reason for that difference that matters. The almost fake patient from my kind of work up to this point, it's actually the rare patient. It would be set up where it's like, I'm totally fine and I just panic, and then now I'm worried about panicking again, and and the one thing about that actually to be aware of is it's 2 things. You can be worried about having those panic attacks, or actually you just start having maladaptive changes. You just start avoiding things that would cause you to have panic, which could be like unexpected or unfamiliar situations. It could be like the agoraphobia things, like you're afraid of being out in places you can't escape. It could be physical exertion. It doesn't even matter. But so it doesn't have to be you're afraid of the panic attack. You actually avoid circumstances which you think might cause it. Whether those are real reasonable, you've experienced it, just you've started doing maladaptive behaviors to avoid it. And that's all that matters. So, and why this matters is that, you have 10 diagnoses. I'm just going to repeat it again real quick. It's just that for anxiety, right? If I go up to the DSM, it's got this list of anxiety disorders. So there's 12 technically. It's like when you're a psychiatrist and you're a pill pusher, that's what you do for a living. There's 3 things you do, right? So there's chronic treatment that you're going to give, like SSRI, SNRI, or you start going down the list, TCAs and stuff, for everyday medication. Then you give the PRNs, which is the propranolols, hydroxyzine, benzos, these things. And then send them to therapy, because a lot of times therapy is the only thing that matters, or if you don't get them to therapy, you're going to be handing out benzos your whole life and they're never going to be any better than they were on day 1. All right, so there's our starting point. We're going to start running over the treatments in the next video. It's been mostly true psychiatry with me. As usual, tell me what you want, or what changes you want, things you don't like, or it's going to just keep happening more and more of this. I will also attach a file below on the diagnosis of generalized anxiety disorder and as a snippet that you can use, or I'll put it in for the text expander that I shared previously. So I have generalized anxiety disorder and panic disorder in it. All right, take care.